Mr. Speaker, for too long, we've neglected mental health in our nation, leaving many to suffer with little hope. Nowhere more clearly is this seen than our rural communities. According to reports, more than 60% of rural Americans living in areas that are experiencing shortages in mental health professionals are suffering with that shortage. More than 90% of practicing psychologists and psychiatrists in this country work exclusively in metropolitan areas. More than 65% of rural Americans rely solely on their primary care providers for mental health care. And in most rural communities, the primary mental health crisis responder is a law enforcement officer, despite not being medical specialists. All across rural America, patients continue to face longer wait times, difficulty accessing travel just to access subpar care by professionals through no fault of their own, not even adequately trained to diagnose and treat mental health issues. In Shasta County, in my district, there is evidently only one psychiatrist in the area, while there's an estimated 4,000 patients with mental health needs. In addition, the lack of mental health care facilities, such as shortage of inpatient beds and space, leaves patients stuck with longer wait times in the emergency room before they can even see a health professional with no other options. While the President's health care law attempted to make strides in this area by including behavioral health coverage, this system is fundamentally and fatally flawed. While continuing to throw federal funding at it may serve as a temporary band-aid for the symptoms of this crisis, it does nothing to address the root of the problem. One-size-fits-all, top-down systems do not work, especially in rural America. If we continue to stand by the status quo, our rural patients will continue to suffer, and in many unfortunate cases end up homeless or in prison, placed an even greater financial burden on our communities, or even suicidal. For this reason, I'm proud to support H.R. 2646, the Helping Families in Mental Health Crisis Act of 2015, and thank my colleague from Pennsylvania for introducing this sorely needed bill. It is said the first step to fixing a problem is acknowledging there is one, and that's exactly what this bill does. We spend approximately $130 billion on mental health every year, yet our country still faces a shortage of nearly 100,000 psychiatric beds. 3 of the largest mental health hospitals are, in fact, criminal incarceration facilities. For every 2,000 children with a mental health disorder, only 1 child psychiatrist is available. Outdated HIPAA privacy laws continue to prevent families and doctors from getting their loved ones and patients the care they need. Our mental health system is broken, but it certainly does not have to be. H.R. 2646 is a great step in rebuilding the system to one that works to empower patients and families access to care and services they need. It brings accountability to the system to ensure every federal dollar is going to evidence-based standards. It improves quality and expands access to behavioral health in our community health clinics while advancing telepsychiatry in areas with limited access to mental health professionals. Importantly, ending the outdated prohibition on physicians volunteering at clinics and federally qualified health centers. In addition, it provides more beds for those in need of immediate care or those experiencing a crisis and improves alternatives to institutionalization so patients can access the treatment they need while it helps us decrease the incarceration rates, homelessness, and reoccurring ER visits. These are just a few of the sorely needed reforms included in H.R. 2646. But I want to stand today to thank my colleague, Mr. Murphy from Pennsylvania, for his leadership in introducing this bill and urge my colleagues to lend their support of this responsible measure to help fix this broken system. I yield back.